Hey there, welcome to the pharmacology lecture series. Today we will be discussing renin-angiotensin aldosterone system, which is more popularly called as RAS. So let us begin with the class. So what is hypertension? So it is the pressure exerted by the flow of blood on the blood vessels. The etiology of hypertension can be due to a wide range of factors. One of the main reasons for elevated blood pressure is increase in the cardiac output and increase in the blood volume. Now, what is the significance of renin release and why and when the renin is released? So, in case of severe blood loss or if there is decrease in the blood volume, the renin is subjected to be released. Or in case of congestive heart failure where the heart muscles are weak so they don't pump enough amount of blood. Or in the case of hypotension where there is decrease in the blood pressure. Now we'll discuss the mechanism of renin release. As we all know that kidneys are made up of millions of nephrons which have unique role in blood filtration in renal system. These nephrons have certain specialized cells which have a specific role in maintenance or regulation of blood pressure. Examples of these cells are first type of cells called as Pulcicin, or they're also called as extraglomerular mesangial cells. These cells measure the volume of blood flowing through afferent arteriole, and whenever there is decrease in the blood volume, it stimulates the release of a special enzyme called renin. Second such cells example, which are called as macula densa. So these cells regulate as chemoreceptors and they are specifically measuring the sodium ions being filtered during glomerular filtration. Whenever there is decrease in sodium ions, macula densa senses this decrease in sodium ions and it tends to stimulate enzyme release which is called as renin. All these cells are tightly assembled at the entrance of the Bowman's capsule and at the distal convoluted tubule. They form a complex called as juxtaglomerular complex, or more popularly called as juxtaglomerular apparatus, which has a unique role of regulating the blood volume and sodium ions by releasing renin. Now moving on to the detailed mechanism of renin release. The first type of mechanism is called as baroreceptor mechanism. Whenever there is decrease in the blood volume in afferent arteriole, these specialized cells will measure the decrease in the blood volume and hence they will stimulate renin release. Second type of mechanism is called as chemoreceptor mechanism. Macula densa, which are situated near the distal convoluted tubules, have a unique role of measuring sodium ions. If there is decrease in the sodium ions in the distal convoluted tubule after the filtration, it senses that and it stimulates the release of renin. Moving on to the third type of mechanism, which mainly is centralized. When the blood volume decreases, then it leads to decrease in the blood circulation to the central nervous system. This is measured by a special type of mechanism by carotid sinus. And when the carotid sinus measures that decrease in the blood volume, it stimulates the sympathetic outflow and releases norepinephrine. These norepinephrine binds to beta receptors present on the juxtaglomerular apparatus and hence further stimulates the release of renin. Now, what happens once renin is released? So once the renin is released, it moves into systemic circulation, and we all know that liver is a hub of synthesis of several proteins and enzymes. It synthesizes a special protein called as angiotensinogen. This angiotensinogen is converted into angiotensin 1 by renin. So renin converts angiotensinogen into angiotensin 1, which is inactive in nature. This angiotensin 1 further circulates and it reaches lungs, where it is converted into its active form, that is angiotensin 2, with the help of specialized enzyme called as angiotensin converting enzyme. Now this angiotensin 2 has several mechanisms, and it has specific receptors spread across our system. So it has its specific receptors on the vascular system, on the adrenal glands, and in central nervous system. So we'll discuss one by one. So angiotensin 2 possesses a vasoconstricting property. When angiotensin 2 binds to the receptors on arteries or veins, it tends to constrict both the arteriolar and venular smooth muscles. Due to this phenomenon, there is excessive squeezing of vascular smooth muscles, which increases the preload on the heart and increases the cardiac output, which in turn will increase the blood volume. Moving on to the second type of receptors, which are specifically present on the adrenal gland. To be more precise, they are present on zona glomerulosa. Once angiotensin 2 binds to it, it stimulates the release of aldosterone. This aldosterone binds to a special type of cells called as principal cells, or they are also called as P cells, present on the distal convoluted tubule on the basolateral membrane, and causes the following actions. The first type of action is aldosterone stimulates or opens the sodium-potassium ATPase channel and increases the sodium reabsorption and increases the excretion of potassium. Further, as we all know that whenever sodium is reabsorbed, it always, along with sodium salts, there is always reabsorption of water. That is, wherever sodium goes, the water molecules tend to follow. This leads to excess sodium and water buildup in our body, which in turn will cause increase in the blood volume. Now moving on to the third type of receptors. So as I said before that, it causes increase or elevation in the blood volume. Now moving on to the third type of receptors, which are situated centrally. So already we have discussed these points, but still I'll refresh once again. Angiotensin 2 has its receptors on pituitary gland. To be more precise, they are situated on supraoptic nucleus. Once angiotensin 2 binds to these receptors, it stimulates the release of antidiuretic hormone or vasopressin. This decreases the urine output and in turn will lead to increase in sodium and water reabsorption. And if there is increased reabsorption of sodium and water, then it will in turn will cause increase in the blood volume. And when the blood flow towards the carotid sinus decreases, this is the second mechanism. When the blood flow towards carotid sinus decreases, the sympathetic nervous system activates the release of norepinephrine, which was discussed in the previous animation. Now, how to control this elevation in the blood pressure? So it is very important to control this. And there are some drugs which can be used to control this unnecessary elevation of blood volume. The examples of drugs are first type of drugs which will block angiotensin converting enzyme, hence they are called as angiotensin converting enzyme inhibitors. Examples include ramipril, captopril, lisinopril, enalapril, quinapril, and fosinopril. So as the name suggests, these drugs will act by binding or blocking the enzyme which is required to convert an inactive form of angiotensin into an active form of angiotensin, that is angiotensin 2. So once it is not allowed that angiotensin 1 is converted into its active form, then obviously it will not cause further elevation in blood volume, and hence we can control the elevation in the blood volume, and in turn we can control the increase in the blood pressure. Moving on to the second type of drugs, which are called as angiotensin receptor blockers. So already we have studied the receptors, where they are situated and what are the roles of these receptors. Once angiotensin 2 binds to these receptors, and what happens after it binds to those receptors. Hence these drugs, which are called as angiotensin 2 receptor blockers. Examples include losartan, telmisartan, valsartan, olmesartan, candesartan, and irbesartan. Moving on to the last type of drugs, that is third type, which will directly bind and they will directly inhibit the release of renin. The example of such drug is, there is only one drug, and which is the latest drug, is called as Aliskerin. So that's all, folks. So this is regarding the renin-angiotensin aldosterone system and the drugs acting on that system. Thank you. And these are the references.